Bridging Health Care. And I am your host, Bridget. Thank you for joining me on this channel. The main focus is helping us to become highly effective healthcare worker, bringing informative, educative solutions to our world. I am so happy you're here. Sit down, relax, like, share, subscribe. Thank you. Hello guys, and welcome to my channel. How have you all been? This is Bridget from Bridging Healthcare, and it's such an honor to be back again to share my contemplations, my thoughts, what I think about being a healthcare professional, the lifestyle of a healthcare professional, how to be effective and efficient at your job. And that is what this channel is all about. I am Bridget Ezobiako, and I'm your host. I'm a healthcare professional myself, and I'm somebody that is given to learning and always wanting to be better. So I'm also open to learning from you. So how's it been? Those of us that have been taking courses since I started this channel, are you done? Have you submitted all your assignments? Have you done your project? If you have not, please get back to it, because the field is green. So many people need support. So what are you doing? Finish your course, put up your CV together, and start working. Get a job. The job is waiting for you. All right, don't let me go too far there, because I'm so passionate about this field, and it's something that gives me joy. So this is just an encouragement. If you are thinking of a field to go into, if you are thinking of a new role, you want to change what you're doing to something else, consider healthcare professionalism. It is amazing. What we do is special. What we do is different. And every day brings a new challenge, which who doesn't like a challenge? All right. Today, I want to talk about you as a healthcare professional improving yourself. Improvement skills. I'm going to give you some ideas on how you can improve yourself as a healthcare professional, so you're not redundant. Imagine that the course you did, I don't know what you've got, a degree, a level 3, a level 2, a level 5. There are more levels to cover. Even if you have done level 7, you can now go on and do a master's degree and just become better at your skill. And before you know it, you will find that particular point that, it's just like doing general practice. So there's general practice doctor, right? And then some people go ahead and say, you know what? I want to be a neurosurgeon. I like everything that has to do with the nervous system. And that's what they do. And some people say, no, I like everything that has to do with geriatrics, old people, mature people. Sorry, not old people, seniors. And then some people, they say, you know what? I want to work with women only. You see? That's another part of medicine. And some people say it's pediatrics, it's children. I prefer young babies, So as you progress in health and social care, you will find where tickles your fancy. For me now, Bridget, I love the mental health part of it. Yeah. I love the mental health part of it. In fact, I'm doing my master's in dementia. So is that interesting? I love everything also that has to do with the back end work of putting up the documents, building up, preparing a care plan, assessment and all that. It's just interesting. And so much has happened since the last time we spoke. Like now I do all that in my role, and it's so amazing. I've got a lot that I'm learning, and I'm excited. And you know what? I work tirelessly. You can see, right? Anyway, how can you improve your skills? Number 1, continual education. So if you go online, there are free courses that you can take just to hone your skills. And if you want to take it a step further, you can do those courses that are already accredited, medication assessment courses. Your organization will most likely send you on trainings. Don't take it for granted. Take all the trainings. I'm telling you, early this year, my organization sent me over 51 courses to do. It's a lot of work. coupled with the busy schedule at work, but I find time to do it. And I'll just taking it one step at a time, one step at a time. You know what? It makes you better because you are getting, live, fresh information, up-to-date information. So the first thing is continual education. Don't play with education. Keep studying. Study. Find out new ideas. You hear something new. Somebody says, this is what I'm going through. Why don't you go on Google? Google is your friend. Search it out. Read about it. Understand it. Know what's going on. Try to find out, follow trends. Do you understand? You are administering a medication. Go and study about that medication. Look at the side effects. Look at what what this medication, if you use it, what you expected, the expectation of the medication. Look at other medications that look like this medication and the differences between this, Those are things. Your company come up with a new policy. Go and research it. What are the laws around it? What are the legislations around it? It makes you effective. It makes you efficient. It makes you smart up here. It makes you, quality. When you're talking to people, they know that, no, this person knows what they're doing. Personally, if I'm working with a client and I just stumble at something I've not seen before, or it's been a while I saw it and I can't remember, because the patient most of the time know a lot about their condition. I ask questions. If they're willing to tell me. If they're not willing to tell me, that's all right. Okay. And then, when we're having conversation, it's not as if I just say, so what is wrong with you? You know how you just be having conversation and, somebody says, oh, I'm feeling this because of what I've got. Say, oh, really? How bad is it? You just empathize and you're compassionate, and you try to understand what they're going through and all that. And I go back and I do my research. It just makes me to be efficient, because tomorrow I might just find somebody else that has got that, same condition. It just keeps my mind prepared. I'm not the doctor, I'm not treating, but I'm supporting, and I must support from a place of understanding. So guys, please, don't play with education. Don't play with education. And education is an ongoing thing. They always say something. The day you stop learning, you start dying. It is absolutely true. So you can learn from anybody. You can learn from your colleague. You can learn from a child. You can learn from an adult. You can learn from a senior. You can learn from any angle. You can be reading something, a newspaper publication. It can be anything. Just have that mindset that I want to learn. That way you will learn. Okay. Then the next step, apart from, education, you do your study. The next step, understand your company and what your company stands for, and how you can go online and read about your company or get your company brochure. You will know how your company addresses situations. So when a situation happens, you can be able to tell, okay, this is the step to take. It just makes you good. It just makes you quality. It just makes you a better professional at your job. Remember, this is a profession. I don't just call myself whatever everybody calls. I'm a carer. No, I'm healthcare professional. And I do much more than caring. You can tell. I do much more than caring. So, guys, that is it on that one. Then the next one is learn on the job. So you are with a colleague who is more experienced, who is more exposed. Learn from them. Don't feel too big. They're doing something you're not doing. Don't be fiddling with your phone or looking elsewhere. Look at them and learn, and be humble enough to just say, oh, sorry, what did you do? How did you do that? That shows that you are a forward-thinking person. Yes. So learn from your colleague. You are shadowing somebody, or somebody is shadowing you, and that person has a skill. Yeah. Just don't, there's no need to be arrogant. There's nothing, learning is learning. So I'll advise you, learn from your colleagues, learn from people that another way you can learn is, for instance, you follow a client for a hospital appointment and, you're seated there and the doctor is having a conversation with them about the situation. Don't just be oblivious and lost and do like you're not listening. You should hear. It helps you to understand. It helps you to know. Sometimes the person might even get to their house and say, oh, I forgot something. You remembered. And when you are doing your reporting, you also have a very good information to give. And that brings me to my next point. In your reporting, when you are taking over shift from someone, can you try and read the last person's report? It helps you to know and understand. It helps you to carry on from where the person stopped effortlessly, easily, without having to say, oh, I don't know this, and then you're calling the person, what happened? If you read a person's report, and the person is a very intelligent person who did an intelligent report, how a report is supposed to be, you're not supposed to call that person, because that is why the report is there. The report is supposed to educate you on how to handle the client from what the person has finished, so it doesn't look like a mismatch, you know? So read your colleague's report, read reports before. In fact, for me, before I go on my call, like even the call are done, and the people that took over from me, I read their reports when I still have access to it. Why? Because I want to be able to understand, okay, was there something I could have done better? Or was there something I didn't do right? Or was there something, okay, based on what I did, what is the outcome? Because maybe I'm not there to see the outcome of maybe I administered the medication. I'm not there to see the outcome. Or this is how the client did when I was there. How did the client do when this person was there? It just helps you to be better. It just helps you to be better and different. So these are some of the points, and I just want to encourage you guys. This field is beautiful. I love what I do, and I know you do love what you do as well. So if you are not in the field yet, please come on in. The grass is green. It can be busy, it can be stressful, but it's highly rewarding. Maybe not money part. Stop thinking about money all the time. Money, money, money. Think about impact that you're doing in people's life, influence that you are, who you are, you're impacting people, you're helping people, it makes you a better person. Anyways, if you have not subscribed to my channel, it's not too late. Please hit the subscribe button, subscribe, like, and share. And thank you for always coming back. This is Bridget from Bridging Healthcare, and our duty is to make you a highly effective and efficient healthcare worker. Ciao.